Hi, I'm Tori Grasse, and today I will be speaking about insomnia. Lying there, staring into your dark room, watching the clock go minute by minute and hour by hour, just hoping you will fall asleep soon. Tossing and turning, trying to get comfortable enough so your body and your mind are at peace. Thousands of people suffer from insomnia, which can affect their lifestyle, but have found ways to overcome the sleepless nights. I have a friend who suffers from insomnia, and I've learned more about the condition by doing my research. Today, I would like to first talk about what insomnia is, second, talk about how it can affect a person's lifestyle, and finally, some treatments that can help you overcome insomnia. Insomnia is difficulty falling asleep or staying asleep, even when the person has the chance to do so. According to an article on the National Sleep Foundation website, insomnia can be characterized based on its duration. Acute insomnia is brief and often happens because of life circumstances. An example being not able to fall asleep the night before an exam or after receiving stressful and bad news. Chronic insomnia is disrupted sleep that occurs at least 3 nights per week and lasts at least 3 months. Changes in the environment, unhealthy sleeping habits, working abnormal hours, and certain medications could lead to a long-term pattern of insufficient sleep. Chronic insomnia can be linked to another medical or psychiatric issue, although sometimes it is difficult to understand this cause and effect relationship. People with insomnia can feel dissatisfied with their sleep and usually experience the symptoms fatigue, low energy, difficulty concentrating, moodiness, and negatively affect performance in work or at school. According to Beatrice Czerkowski in her 2006 Managing Insomnia article in Orthopedic Nursing, 35% of the population complains of acute insomnia, and at least 10% of those reported having chronic insomnia that affects mental function, interpersonal relationships, occupational stability, personal safety, in response to psychological stress. Insomnia increases the risk of mental illness and can trigger any pre-existing illnesses as well. According to Pat McDonald's 2008 book, How to Help Patients with Insomnia, the cerebral cortex is responsible for sustaining attention and planning aspects of behavior, including speech and working memory. When sleep deprived, not only do we have trouble expressing ourselves, but there is also limited access to long-term memory, and we find it hard to express and convey our ideas at night. At night, time seems to behave differently, stopping or jumping ahead in an alarming way, and when we are unable to sleep, sensitivity to our emotions is raised. If we are frightened or worried, for example, insomnia increases our anxiety. During the long nights of winter, those with seasonal affective disorder have an even higher time and may lose motivation and withdraw. Treatment becomes necessary once insomnia impairs sleep quality to the degree that it negatively affects a person's health or ability to function during the day. According to the Harvard Mental Health Letter published in February of 2011, the best treatment for chronic insomnia is cognitive behavioral therapy. CBT helps patients change negative thoughts and beliefs about sleep into positive ones. For example, you would say, "I'll never get a decent night's rest," and change it to, "I stand a good chance of getting a good night's sleep tonight." The biggest obstacle to successful treatment with CBT is patient commitment. Some people fail to complete all the required sessions or to practice the techniques on their own. According to an expert review of pharmacoeconomics and outcomes research, Most people use prescription or over-the-counter medications if they have sleep problems. Many medicines cause side effects such as low blood pressure, anxiety, and nausea. These medications also may become less effective when your body gets used to them and may cause withdrawal. Symptoms when you stop using them. In conclusion, we have looked at a common sleep disorder that affects thousands of people worldwide. Thousands of people suffer from insomnia, which can affect their mental health, but have found a way to overcome the sleepless nights. To review, we went over what insomnia is, how it affects our daily lives, and the options for treatment. Thank you.